Okay, hello everyone. Thanks for joining. While we let folks into the room and settled, I will give some tech overview and then we'll get going. Really excited to see so many people joining us today. So I just have a few announcements and some housekeeping that we wanted to provide. So first, my name is Sarah Wee. I'm CSAJ's Director of Research and Programs. I go by she, her gender pronouns, just in case you need to chat me. And also online is our project coordinator, Terrence Joseph. So he and I are going to be your tech hosts and support today. So we just have a few notes that we wanted to go over. First, we are recording or will be recording this webinar. All of you who and anyone who registered will receive an email directly from us, from CSAJ, when the recording and PowerPoints and all other materials are ready and posted on our website. And since this webinar is part of a series, the next part happening next week, you should have access to all of that at the end of the month. But again, we will email you directly when all the materials are ready to go. Second, we hope that you'll engage with us. We do have limited seating here, so if a colleague or someone is trying to log on, we are streaming this live on YouTube, and maybe Terrence could help by inserting the link in the chat so people have it, and we'll make that accessible to everybody. Also, we are, because this is about partnerships and innovation, and we have count them 3 innovative partnership initiatives that we're hearing from today, we really are going to rely on you to help fuel discussion. And we also want to know how things are resonating with you. So you can email us at info@csaj.org. You can tweet with us. You can go to us on Facebook. Let us know how things are going for you, what's resonating. And here's how we're hoping you'll engage with us online right now. First, you can toggle in and out of full screen in the upper right-hand corner with those 4 arrows to change the way that you're viewing the screen. And then importantly, take a look at I believe it's on the bottom of the window, some key icons and tools that we'll be using. First, you'll see, you should see options for how you want to join by audio. You can select phone or computer. Everyone is muted. There's also a Q&A button, and feel free to submit any questions you have for presenters here, and we'll monitor those and make sure they get answered either during the webinar or afterwards. And then the chat, the little word cloud bubble. This is our main feature, and we encourage you to use it to introduce yourself, ask any questions, chat with each other, chat with presenters. That is our main tool today. And then finally, if you are experiencing any technical difficulties, if you can't hear, if you are having trouble viewing the slides, whatever it may be, click the raise hand button and Terrence or myself will chat with you directly to try to troubleshoot and resolve it. So to practice, before I hand it off to Yvette, introduce yourself. I'm going to chat here. Hello. So hopefully you saw your chat box light up, and if you could introduce yourself, let us know your name, your organization, maybe where you're from, and any question or curiosity you're bringing with you today, that would be really great. We will be asking you to engage and think about questions throughout the webinar today, and it's a great time to start. So thanks, Joan, for getting us started. I hope everyone else takes some time to introduce themselves. So with that, I'm going to start recording and hand it off to Yvette, who is our Director of Capacity and Systems Change, and she'll be facilitating and introducing our presenters today. Yvette?
Great. Thanks so much, Sarah. Hello, everybody. Thanks for joining us today to discuss innovative initiatives to addressing economic and consumer barriers to housing. I want to echo Sarah's enthusiasm and encourage you all to keep sharing who you are, where you're from, and why this issue is so important to your work as we go along. Next slide, please. We will have 6 excellent faculty joining us today. I'll leave the introductions to Larissa, who you will hear from shortly. But first, next slide, please. I wanted to give a brief overview of what's happening today. Everybody will get to engage in a dialogue with the 3 housing initiatives that Sarah mentioned, discuss promising practices in advocacy and partnership building to address systemic and economic barriers to housing. And then as part of everybody's involvement and participation today, it'd be great if everybody can, think about how to apply the work of these initiatives to your own organizational context. As the conversation goes on, please share any ideas that come to mind for use in your own work. There'll also be resources at the end of the webinar and available for download after to help you brainstorm around needs assessment, partnership building, and systems change. Next slide, please. So just to give a brief overview of CSAJ, we promote advocacy approaches that remove systemic barriers, enhance organizational responses, and improve professional practices to meet the self-defined needs of domestic and sexual violence survivors. And we envision a world where all people have equal access to physical safety, economic security, and human dignity. Next. This webinar is part of our Consumer Rights for Domestic and Sexual Violence Survivors initiative, which seeks to enhance the capacity of domestic and sexual violence advocates and attorneys to address survivors' consumer-related needs. And now, without further ado, let me turn it over to Larissa Kaufman, Director of Systems and Policy Initiatives at the National Alliance for Safe Housing, who will introduce the issue and our panelists.
Yvette, thank you so much. And before I go any further, I just want to thank CSAJ for hosting this, for inviting all of us to participate. We are so excited to be here today. So I'm Larissa Kaufman, and I'm with the National Alliance for Safe Housing. And I just want to take a moment to briefly introduce the panelists that you'll be hearing from today. You'll be hearing from Carlo Ng, the supervising attorney at the National Housing Law Project, Connie Swan, senior domestic violence case manager at the Casa de las Madres, Elizabeth Eastland, the executive director for Rainbow Services, Amy Turk, the chief innovation officer at the Downtown Women's Center, Alicia Sanchez, the domestic violence regional coordinator in SPA 3 with Union Station Homeless Services. My job today is to moderate this amazing panel and also to provide sort of a national overview of best practices and models, 2 of which we're going to be really highlighting today from San Francisco and Los Angeles. And before I get there, I want to just briefly talk about the National Alliance for Safe Housing, which is the organization that I'm with. And I posted in the chat box that many of you, your names and your persons are familiar. I've either met you in person or you've been part of other webinars that we've done. So it's very, very exciting to see you as part of this one. So just briefly about the National Alliance for Safe Housing, we are a national technical assistance provider. We were formed in 2015 as a project of a local domestic violence organization called the District Alliance for Safe Housing. Excuse me. Our mission is to ensure that survivors of domestic and sexual violence have access to a full range of survivor-defined housing options. We work at that center of domestic and sexual violence and homeless and housing and provide technical assistance on a range of issues, ranging from housing protection implementation to ensuring that survivors have access within the COC's coordinated entry system. So I thought what made sense to sort of lay the foundation for our panel discussion today was to actually highlight a national needs assessment that the National Alliance for Safe Housing conducted in 2017. And this needs assessment was focused specifically on safe housing. It had 3 goals: to gather input from community service providers, coalitions, and continuums of care on a variety of topics that I'll talk about briefly in a moment, to identify any barriers that might hinder or prevent collaboration amongst organizations, and to identify promising practices amongst the organizations and their collaboration methods. So we surveyed domestic and sexual violence coalitions, rape crisis centers, domestic violence housing and shelter programs and non-residential providers, homeless shelters and housing programs, homeless coalitions, and homeless management information systems, also known as HMIS, and also the Continuum of Care collaborative applicants. We had over 2,100 respondents from all 50 states, DC, and Puerto Rico, and 442 of that total identified as working for culturally specific organizations. So the topics for that safe housing needs assessment ranged. They included collaboration and partnerships, training, coordinated entry, confidentiality, HMIS and comparable databases, housing approaches, housing legal protections for survivors, and funding. And the needs assessment data sets the stage for the national best practice models and provides further context for the amazing work you'll hear about in San Francisco and Los Angeles. Specifically, how these communities have built a coalition, task force, or committee, they go by different names, that are focused on safe housing for survivors, as well as how in San Francisco and Los Angeles, there's been an institutionalization of a co-location model to bridge the silos and to help ensure survivors have access to safe housing. So before I shift gears and pass it on to San Francisco and Los Angeles, I'm going to share some data sets from the needs assessment to highlight how these are really, really critical practices that we hope that many of your communities will adopt after hearing from us today. So according to the needs assessment, over 60% of the homeless and housing and domestic violence and sexual assault organization respondents reported that the top barrier to knowledge of the scope of the other systems programs was not enough communication with organizations from that system. And nearly 70% of the culturally specific respondents also reported communication, not enough communication, as the main barrier. Promisingly, over 50% of domestic violence and sexual assault organization respondents reported being involved with homeless and housing system meetings in their areas. And of those, over 50% also reported that their participation and feedback was valued. However, only 37% reported survivors' needs being discussed at the meetings, and only 30% reported that survivors' needs, when discussed, were adequately addressed. And so one of the key best practice model recommendations from the report and from us as a national technical assistance provider is establishing a community-wide domestic violence and homeless and housing coalition or task force, which can help facilitate collaboration and deepen communication and partnerships across the sectors. We also highly recommend incorporating representation from domestic violence and sexual assault programs into homeless and housing system meetings, including survivors with lived experiences, which you'll also hear more about in practice today. So let me shift into some data around the co-location model in the needs assessment. So 42% of the domestic violence and sexual assault organization respondents reported that their clients worked with homeless and housing organization caseworkers at homeless and housing programs, which is fantastic. And 89% felt this approach was helpful. However, only 14% of domestic violence and sexual assault organization respondents and 16% of culturally specific respondents said their organizations had co-located staff at a homeless and housing organization. Those numbers are low, but 80%, and this is what is so incredible to find, 80% of the 14% that reported using a co-location model, this was both of the DVSA organizations and also the culturally specific respondents with co-located staff, felt that this practice assisted survivors with their housing needs. And so, of course, naturally, the co-location model, not just from our national needs assessment, but from what we know in the field and on the ground and hearing directly from survivors and programs, we know that this is a model that really works and can break down the silos encountered by survivors seeking housing access and safety. And so without further ado, I'm going to go ahead and introduce our first set of panelists. Before I do that, I made a note to myself to remember, we are saving the question and answer till the end after everyone presents, but that does not mean you have to hold your question. So please feel free to use the chat box to put your question in. You can specify who it's for. I'm going to poll a couple of questions so we can get to them at the end, and we might get to them during the panel discussion as well. So without further ado, we are first going to look at San Francisco and the incredible work that they are doing there. And I'm going to pass it off to Carlo Ng and Connie Swan from San Francisco, and they will briefly also introduce themselves and share a little bit about their organizations as well. Thank you all so much.
Thank you so much, Larissa, for that wonderful introduction. Hi, everyone. I'm Carlo Ng. I'm a supervising attorney at the National Housing Law Project in San Francisco. I'm going to briefly just give you a little bit of information about NHLP. Our mission is to advance housing justice for underserved people and communities. For over 10 years, our organization has been funded by the Department of Justice's Office on Violence Against Women to serve as a national technical assistance provider on the housing protections under the Violence Against Women Act. Through this work, we've worked with thousands of advocates and housing providers across the country on compliance and implementation issues related to the Violence Against Women Act. And also through that work, we've done quite a bit of state and local work. And one of the major projects we've had is to work on a project called the Safe Housing Project in San Francisco. Next slide, please. I'm just going to provide a very brief overview of the Safe Housing Project because Connie Swain, who is actually one of the domestic violence liaisons of the Safe Housing Project, will go into much more detail. But basically, the project, the Safe Housing Project, started about 5 years ago. We were fortunate enough to be able to get funding from the San Francisco government that is now a line item within the city's budget that will continue for as long as we hope that it can continue to fund 2 positions that are co-located at the San Francisco Housing Authority as well as La Casa de las Madres, which is a domestic violence agency in San Francisco. Just to provide you a little bit of background for those who don't know what a public housing authority is, these are state-created entities whose function is to administer federal affordable housing programs. And usually that means some stock of public housing and or Section 8 vouchers or housing choice vouchers. And so here in San Francisco, our local housing authority administers both public housing and Section 8 vouchers, as well as other affordable housing programs that Connie will talk about more, but a program called the Rental Assistance Demonstration Program, or RAD for short, as well as a few other programs. So the San Francisco money that we were able to get 5 years ago funds 2 positions, 2 domestic violence liaison positions. And their jobs as the liaisons are really to serve survivors, domestic violence and sexual assault survivors who need help getting some kind of remedy related to the housing challenges that they are experiencing. So some examples include emergency transfers, lease bifurcations, lock changes, and any issues that might relate to potential eviction issues. So these survivors go to these liaisons who are actually physically located at our local housing authority. Their office is at the housing authority. And in addition to getting assistance in terms of navigating the often bureaucratic system of the housing authority, they're also able to get other kinds of support services that La Casa offers. And again, Connie will go over some of those services. And this project was really born out of the Family Violence Housing Committee, which started in 2010. This committee is comprised of folks from legal services, leaders from the domestic violence agency, as well as other social service agencies in San Francisco, and also members, folks who are at the San Francisco Department on Status of Women. It's a local agency that we have that focuses on issues that impact women in San Francisco. And so we've worked as a collaborative for quite a while now, and one of our main goals has been to develop good VAWA and domestic violence policies with our local housing authority. We saw that there were many problems that the housing authority had. For example, before we had the Safe Housing Project, when we asked the housing authority anything about emergency transfers, including basic questions like, well, how many emergency transfer requests have you received from survivors? They would have no idea because they were not tracking any of this information, and they certainly were not monitoring whether any of the requests from survivors were ever followed up on or whether or not they were successful. Next slide, please. So in addition to having the Safe Housing Program, as part of our relationship with the Housing Authority, we were also able to get a number of really great policy changes. We don't have a lot of time today to talk about exactly how we were able to get these policy changes, but I just want to highlight them here just because some of these changes have really made huge differences in the lives of survivors in terms of their ability to access and maintain safe housing. And I want to also mention them because some of these things, I think some advocates have come to us and said, it'd be great if we'd be able to get certain policies in place, but we're not really sure whether or not that's possible. And I feel like if one housing authority is willing and able to move forward with some kind of progressive policy that really benefits survivors, that other housing authorities and other housing providers would likely be able to do that as well. So some of the major policy changes that we've seen essentially over the last 10 years includes major amendments to VAWA and domestic violence policies in the program operation plans. Some of you on this webinar today might be familiar with certain planning documents called the Admissions Occupancy, Continued Occupancy Plan, or the Section 8 Administrative Plan. So these are policies and documents that govern the day-to-day operations of the public housing and the Section 8 voucher program. Through a lot of advocacy over the years and a lot of conversations with housing authority personnel and also executive folks, we were able to include a lot of really great VAWA policies in these plans, which have since been implemented through training to the staff. So a really good example is admissions preferences. Admissions preferences for domestic and sexual violence survivors are completely optional for any housing provider, including housing authorities, although HUD does really encourage housing authorities to adopt admissions preferences. A lot of housing authorities do not have them, but our housing authority does, and that has been tremendous for survivors. Our relationship with the Housing Authority has also allowed for us to have direct access to the people who make decisions at the Housing Authority. And generally, these are people at the management level and senior program staff. That has been really vital in terms of getting real remedies and solutions for survivors. Our Housing Authority, after 5 or 6 years of talking to us and then sort of checking with different attorneys about whether or not they could actually do this, decided to actually put aside 20 vouchers a year that are reserved specifically for VAWA emergency transfers. So what this means is that folks who are survivors who are in public housing are able to get a Section 8 voucher for emergency transfer purposes if they cannot find another public housing unit that is safe and accessible for them. We've also developed an emergency referral policy. That's basically an emergency transfer plan that has been very, very helpful. Connie will get into sort of that referral policy and what it's done, but I just want to flag that because it's actually not only one that is compliant with VAWA's requirements, it also has been really practical and operational for advocates and survivors. Through the Safe Housing Program, we've also been tracking and monitoring the requests that survivors have had, and we have some data that we'll share in today's presentation about these requests and their success rates. And then we also provide regular training for staff and property managers at the Housing Authority, as well as other property managers that are associated with the Housing Authority. And we found that these trainings are also vital because of the amount of turnover at the Housing Authority as well as property managers. So there's a constant need for education and re-education on VAWA and related issues. Next slide, please. Next slide, please. So I think there's a little bit of a lag. So without, mine hasn't changed
for you. Oh, I'm sorry. Let's try.
Okay, great. I see it. Thank you. So, I think it actually skipped one. Before it. But I'll go ahead and introduce Connie Swain at La Casa de las Madres, who's an amazing senior case manager and one of the domestic violence liaisons at the Safe Housing Project.
Thank you, Carlo. Hi, and as Carlo said, my name is Connie Swain, and I work for the agency here in San Francisco called La Casa de las Madres. And so what is La Casa de las Madres? So we are an agency that was founded back in 1976 by a group of women, and we were actually the first in California and the second in the nation to have a domestic violence shelter for women and children. So our main office, where we've just recently moved, is at 1269 Howard Street. And some of the services that we do provide, that we collaborate with within our organization, is one here at the San Francisco Housing Authority, and which is our Safe Housing Project. We also work with CalWorks, Domestic Violence Response Unit, through the Special Victims Unit at our police department at 850 Bryant. We also have a program called Arise through the Zuckerberg San Francisco General Hospital. We also have a transitional housing program that we work with for single women who have been victims of domestic violence, and that is through our Mary Elizabeth Inn, as well as Verona. There is also Bayview, which is our high-risk response team. Then we have a team program, which is through the San Francisco Unified School District's Wellness Center, as well as other community-based organizations, as well as our shelter that I spoke about when I first introduced myself. And we have a 24-hour, 7-day-a-week, 365 days a week crisis line, as well as a text line for adults and teens. So the next one is, what is the Safe Housing Project? And so the Safe Housing Project was created, as Carlos said, it was through a collaborative of partnerships, which was between the Department of Status of Women, and have since pretty much collaborated with the National Housing Law Project, Bay Area Legal Aid, and the Asian Women's Shelter. And this project was created to prevent housing instability caused by domestic violence and mounting vulnerability, which often accompanied a lack of safe, decent, and affordable housing. The next one is pretty much, well, I just wanted to just touch bases, just who do we serve, and that's individuals affected by domestic violence who live in San Francisco housing, public housing sites, Section 8, and also the newly RAD, which stands for the Rental Assistance Demonstration Sites. And these were previous San Francisco housing properties that have now moved on to private to rehab. And what services does the Safe Housing Project provide? So we pretty much provide and assist individual survivors and victims with emergency transfers, housing advocacy, as changing locks, relocation, porting in or out with their Section 8 voucher, bifurcation of their lease. We also assist with court accompaniment. We also provide and assist with warm handoffs to community agencies, one being Bayer Legal Aid, CROC, which is the Cooperative Restraining Order Clinic, victims services through the police department. And so also we do have the ability to travel directly to the housing sites, but not to families' homes, but we definitely have the ability to go into the site and meeting with them. And we also provide support groups as well as what Carlo mentioned, staff training. And what support is provided to property managers and service connectors, and that's the primary is what we do is, as I said, help and collaborate with emergency transfers and referrals. We provide office hours and support groups at various housing sites, and as well as act as liaisons between residents, property managers, and San Francisco Housing Department, San Francisco Housing, as well as I mentioned, providing actual staff training where we collaborate with our collaboratives. So what kind of cases do we see at the San Francisco Housing Project? So one, I will definitely say when first beginning and first starting with this collaborative, which was about almost 5 years ago, the challenges that I personally seen was difficulty trying to connect with key staff in order to effectively advocate for the residents that were in need of VAWA. The most significant challenges was when RAD had first started, and that was the transfers of properties, where at one point in time it was difficult connecting and recreating relationships with the new property sites and the monitoring sites to establish a relationship. We encountered challenges when they were we actually encountered challenges when trying to obtain a clear understanding pretty much on how the emergency transfer wait list was going to be impacted and administered by the individual sites. And then also during this transition, transfers were temporarily frozen, and no one was really pretty much able to move into safety zones when this transition was happening. Offering units in a safe zone within the safe area for former individuals that were victims of abuse, not knowing the correct department to outreach to. When first beginning, it was a challenge connecting to the correct departments to obtain a correct staff of various services that we were requesting. And then what are the pretty much are the current challenges? And that would be, at this point, I'm not sure if everyone knows, but that the city and county is going through their shortfalls, and at this point, the city is taking over and contracting out. And so La Casa, within our organization, we're currently back to pretty much ground zero, where we're trying to reestablish our connection, and also just establishing our real connection with the monitoring sites, and just really trying to access and find out who are the appropriate people to reach out to when it comes to our VAWA residents. So, so then the next one is, so how does the Family Violence Housing Committee play a role? So with this one, through these collaborations, the San Francisco the Safe Housing Project have created the ability to meet on a bi-monthly basis to discuss various challenges that we may face during our advocacy for the VAWA, for VAWA laws that may present themselves during the course of working with the VAWA clients. Am I still connected?
Yes.
Okay, thank you so much.
Yep.
I'm sorry about that. Okay. And then, so by working in unison with our partners, clients are more equipped legally and policy-wise to better assist them with their journeys to safe and self-sufficiency. So by working together, we are not only gaining the great knowledge on San Francisco Housing Authority policies, but also gaining knowledge to access various sectors, which are some as far as the TCAC subsidies, low-income housing, MOD, single-room occupancies. This not only benefits us as case managers, but also trickle down to the survivors who unanimously benefit from the knowledge gained by helping them. By having this joined collaboration, clients are informed about their rights as survivors, as well as their legal rights. Not only are these collaboratives helping us to become more knowledgeable about VAWA and its laws, but through the collaboration, also are able to spread awareness on all things domestic violence through training and education. I know that I kind of missed as far as our percentages when individuals are coming in, being referred to us, and I kind of wanted to go back to that a little bit, and I want to say that's, yes, so the one where it says what kind of cases do we see at Safe Housing Project, and so I just wanted to talk a little bit more about that one as far as our total intake that we have worked with our referrals for individuals who have experienced who experienced domestic violence, and we work with them. And so with that, those 460 folks, we have actually had 40% that were actual emergency transfers, being that through the public housing or through their Section 8, be that being ported in or ported out, also through the RAD and the tax credit. And then it's just a percentage of all of those. And out of those 40%, we've actually successfully been able to assist 84% with their emergency transfer request that has actually led to transfers. That would either be with bifurcation of their lease and them either staying in their unit or being moved on elsewhere, obtaining or either obtaining a new voucher, or, as I said, moving out and relocating. We definitely have been able to work with and successfully assist families and individuals who are victims of domestic violence. So I just wanted to go back over and just talk a little bit more about those percentages. So we can go back. We can go back to the next one, and I can just. So Carla, is there anything that you want to add in before I at least just give a case sample case?
No, that was wonderful. Thanks, Connie. I think we have 3 more minutes for your section, so just FYI. Okay.
So then I definitely wanted to at least talk a little bit, just giving a sample case where we actually worked as a collaborative, because this has been a great service for me with working with this collaborative. And as I said, just really working hand in hand when there are VAWA questions that come up and when there are resistance when it does come to bifurcation or assisting individuals in obtaining their emergency transfers or referrals. That part I just wanted to, really express how this collaboration here in San Francisco has been really a great source for me, for our particular program here at La Casa, where we've been stationed here at Housing Authority. And so with that, I wanted to just give a quick, sample case where we have worked together as a collaborative, and that is where I had a particular individual that was the head of household who was being abused by the secondary. And with that secondary was more or less the primary income holder, and not only was it physical, but it was monetary abuse as well, where the secondary was the primary income holder, but was not really contributing to the rent, which caused the victim to, there was a whole household to fall back in becoming behind on their rent, and this victim did not really know of their options, of their choices, but through one of our support groups that we had, they were able to find out information that we provided on-site services, and from there they reached out. We were able to connect and work with them and educate them around what their VAWA rights were. They actually were able to, we were able to assist them with putting in for a emergency transfer, but because of the fact that they were behind on their rent, Housing Authority was telling them that they could not be put on an emergency transfer list until they paid or were in good standings with their back rent. And so what we did was at least help them with connecting with that resource, but then also they were trying to bifurcate their lease, and the abuser was told that the lease was trying to be broken, and so the abuser asked for an informal hearing, and that happened. But what simultaneously happened is that none of the information was provided to Housing Authority that this victim was exercising their VAWA rights, and the ruling was in the perpetrator's favor. And so what we did was reached out to National Housing Law Projects, connected them with Bay Area Legal Aid, and was able to get them connected with the resources and the services to assist them with us being able to ask for a rehearing, and also simultaneously getting them in good standings with their back rent and getting them on the emergency transfer list. And so I just wanted to just say a little bit just in regards to how this collaboration has really been, really great with helping with all of those processes when things like this come up. I don't know where I am on my time, but I just kind of wanted to definitely give that part in regards to just a case study.
Thank you so much, Connie. This is Larissa back in moderator role. I want to thank Connie for sort of ending it and really bringing it to life directly with how the various collaborations worked for a survivor within these huge systems that can be really challenging to navigate. And I also want to thank Carlo, both of you, for really bringing to life what's happening in San Francisco with the amazing efforts there. And I'm going to move us into Los Angeles now. I'm going to pass it over to Amy Turk and Elizabeth Eastland, who are going to talk about the Domestic Violence and Homeless Services Coalition and some of the other efforts there as it connects. And then Alicia is going to close us out talking about the co-location model and how it works with their coordinated entry system. So with no further ado, I'm going to go ahead and pass it over to Amy and Elizabeth. Amy and Elizabeth.
Thank you so much, Larissa. This is Amy Turk with Downtown Women's Center. We're in downtown Los Angeles, and for the last 40 years, we've been providing services for women experiencing homelessness, including housing, healthcare, and workforce development. And I'm excited to be here with Elizabeth today.
Good morning, everyone. Okay. Hi, everyone. This is Elizabeth Eastland. I'm the Executive Director of Rainbow Services. We've been around since 1983, providing shelter and support services to survivors of domestic violence, helping them to regain their power and move beyond trauma and towards safety and stability. We were one of the first domestic violence organizations, at least in Los Angeles, to co-locate a DV housing advocate with a coordinated entry lead organization. And we proudly co-lead the DV Homeless Services Coalition along with Downtown Women's Center.
Great. You can move to the next slide. So we wanted to share a little bit more about the model behind the Domestic Violence Homeless Services Coalition that Rainbow Services and Downtown Women's Center are co-leading. We're really excited that in 3 years, it's grown to about 600 individuals and 80 organizations participating. And our main goal is to increase access to safe housing and services for survivors and their families. And foremost, we are doing this work with people who have lived through domestic violence and homelessness. Our lead and founding partners also include our local continuum of care, which is the Los Angeles Homeless Services Authority, Community Legal Aid of Southern California, Corporation for Supportive Housing, specifically their Speak Up advocacy program, the Los Angeles County Domestic Violence Council, and a local champion in elected office, Sheila Kuehl, through our Los Angeles County Board of Supervisors. And Elizabeth will share now more about what some of the reasons from a domestic violence lens of why we built this coalition. Next slide, please.
Thanks, Amy. One of the things that we always talk about when sharing about the coalition is before we started, we were really working in silos. While some organizations had relationships between DV services and homeless services, for the most part, our systems operated separately. And what we were seeing were survivors falling through the cracks. If they hadn't had a recent episode of domestic violence and weren't actively fleeing, the domestic violence systems of care, the shelters, wouldn't take them. And if they went to a homeless service organization and said that their last incident of abuse was in the past 12 months, Homeless Services was often telling them to come back to the DV systems of care or go to mental health. And so survivors were just kind of being pushed around these different systems. And, you know, originally the DV system of care was set up to deal with the immediate crisis and people fleeing immediate danger. But in recent years, we've really seen a change to a lot of people calling us who have been homeless for some time. And so we've really shifted our policy at Rainbow to take in people if they're initiating cause of homelessness is connected to domestic violence. And traditionally in our DV systems of care, we haven't been as focused on permanent housing. I think that those of us who have transitional housing, it's definitely always been one of our goals to move households to permanent housing, though we didn't always have the same access to permanent housing opportunities as, say, homeless services did. Next slide, please.
And to share from a homeless services perspective, as Elizabeth mentioned, the homeless services were not necessarily, built to work with domestic violence survivors either. Certainly, homeless service providers typically are not trained on, certainly very few go through the domestic violence counselor training. Very few are assessing or screening for domestic violence in ways that are not re-traumatizing. Lots of back and forth in terms of referrals that may or may not work out. And, whereas the DV side may not be as aware of permanent housing options, of course, the homeless services side is, but the homeless services side has historically not focused as much on trauma-informed care practices as the DV side has. So all this combined really led to kind of a perfect storm for us that Elizabeth's going to share more about.
Yeah, so back in 2016, both the city and county of Los Angeles came up with comprehensive homeless strategies and homeless initiatives. These were, between the city and county, 300 pages of strategy and a 10-year plan to end homelessness. We love 10-year plans in Los Angeles. We've been doing them for decades. But what these initiatives and these 300 pages of strategy failed to address was how do we focus on survivors or even the needs of women that may be different than our traditional homeless service provides. So in that's about the time that the leadership of Downtown Women's Center came and met with myself and others in the city's Domestic Violence Alliance to talk about how do we advocate for additional strategies with the city and county to ensure that the needs of survivors and the needs of women are being met. Next slide, please. And so we came together in February of 2017. Actually, during 2016, we were all on this work group together with the County of Los Angeles to look at those very homeless initiatives. But the coalition came together in 2017, and this is our structure. We have a core team made up of one representative from each of the groups that Amy discussed when we first began. We have 3 different work groups that we'll describe in a few minutes. We're really fortunate to get to work with the National Alliance on Safe Housing and Larissa to evaluate the impact of our coalition and our work together. We provide full coalition convenings where we invite anyone who's ever been a part of the coalition to look at different topics at the intersection of DV and homelessness. And in August, we just wrapped up our second Community Connection Summit, bringing together over 300 advocates from the DV, homeless services, and city and county departments. Next slide, please. So as I stated, we got our start in 2017. Our initial convening in February, we were mindful about who we selected to attend that event. We wanted to make sure that we had a good representation from all areas of the county. As you know, as some of you may know, Los Angeles is really quite large. So we wanted to make sure that we had a good balance of DV advocates, homeless services, city and county departments, funders, and looking at, do we have people that are representative of the different communities of color in Los Angeles? And what we found in that initial convening, we based our work groups off of the feedback that we got from those leaders who joined us at that first convening. And then in June, we looked at a continuum of safe, stable housing together. In the fall of that very first year, we conducted the Survivor Needs Report or Needs Assessment, and we finalized our goals and logic model with NASH. And in October, we held our first Community Connection Summit. I believe that first one was attended by well over 200 people. Next slide, please.
So in March of 2018, just to further flesh out what our coalition looks like, we started disseminating our model nationwide, and we presented at the Housing First Partners Conference and are continuing to help disseminate the model to other communities. And April of that year, we revealed the results of the Survivors Needs Assessment, which was county-wide surveying and meeting with women who have experienced homelessness and domestic violence. The results of that are on our respective websites, the Downtown Women's Center and Rainbow Services. But the main recommendations that bubbled up from that were the need for flexible funding, less rigid criteria to enter programs, and an increased need for access to mental health and legal services. And then in July, we dove deeper into figuring out how domestic violence survivors can utilize the benefits of coordinated entry. And those conversations, as you can imagine, were challenging. And we really then created more agreements within our coalition about how we would be moving forward with that important work together, which really helped us get very clear on our shared values and the ways that we could advocate together. And all along, we've been continuing to work with NASH. So back in October, they came back and shared about the progress we were making from an evaluation perspective. Next slide.
Yeah, and then this year, at the beginning, based off of what Nash shared with us last October, we brought together a full convening to look at our accomplishments, to review the evaluation results, and set strategy for our future work together, including gathering input on what a membership agreement would look like, and how do we get people to stay connected. Just this past August, as I said, we had our second Community Connection Summit. Just last week, we kicked off our allyship program, and we had a training on advocacy and how to provide public comment during meetings and how to get clear on our advocacy message. Then in November, our next convening, we're going to focus more on co-location, identifying the successes and challenges of working together. Next slide, please. And then, so this is Elizabeth, I run the Systems and Funding Work Group, which is really focused on data and confidentiality, partnerships, policy advocacy, and from that group, we developed the shared values for the coalition that then the core team adopted last summer, and we really spent several sessions in the Systems and Funding Work Group looking at our shared values, looking at the myths and the realities of the different systems and where do we overlap. And the shared values is on both of our websites if you want to take a look at that. And we really, in Systems and Funding, also develop advocacy points when local policy needs to be giving more attention to survivors and women and their needs who might be experiencing homelessness or housing instability.
This is Amy. I get to oversee the client-centered work group, and this is where a majority of the participants are coming with lived experience. And together, and just to set, reading that focus group report, conducting that together, really wanted to focus more on our advocacy and our building the skills for advocacy. And in our third work group, this is led by our continuum of care partner, LASA. They're really focused on education and training. A majority of that has been to increase training within our community. So now homeless service staff are more likely to be attending the DV counselor trainings, and there's more cross-sector training. And they've been very focused on building a confidential and safe portal so that DV survivors can be entered into coordinated entry and have access to the permanent housing resources within the system. Next slide. And we wanted to share a little bit more about the work that's come out of the client-centered work group. This is now called an advocates program. And so the structure of our advocates program is to work with people who've lived through domestic violence and homelessness. And we're focused on training. So we have monthly skills-based training on advocacy and how to be effective in our advocacy in government in particular. We also host a sort of business meeting, if you will, to help the advocates learn about the policies that we're working on and to plan for upcoming advocacy efforts, which in our community is usually giving public comment at city council meetings or board of supervisor meetings, just coordinating all the logistics around that too. And really this group came with a lot of advocacy skills, but what they identified was needing more emotional support through the process. And a lot of things can come up even in a city council meeting that need more talking through. And so one of the advocates in the group leads a peer support group once a month, which has been really, really supportive. And then as Elizabeth said, just last Monday, we've paired each advocate with a person who works in homeless services or domestic violence services or government, sort of a systems leader in our community, so that the advocates get even more attention and support in their advocacy, but also importantly that system leader can learn from people's direct experience and take that to deepen their work and engagement. And none of this is for free. Thankfully, we do have some funding to compensate for the time of the advocates, which is incredibly important given that most of the staff are paid for their time in this work as well. So next slide. Part of our coalition has been helping Los Angeles County build out our new DV regional coordinators. So we were a part of advocating for the funding that now makes that possible countywide. We helped build and advise the job description, and we're constantly assessing and working with NASH to evaluate the effectiveness of co-location. And we're just so excited that these DV regional coordinators are also a part of this coalition. So it's my pleasure now to hand over this session to Elisa Sanchez, who's a member of the Domestic Violence Homeless Services Coalition, to talk more about her work as a DV regional coordinator at Union Station. But in the next slide, if you have any questions about the coalition in Los Angeles, here's our contact information. We're looking forward to engaging further with you all. Thank you all.
Hi, everyone. Thank you, Amy and Elizabeth. My name is Alicia Sanchez. I'm the Domestic Violence Regional Coordinator for Union Station Homeless Services in SPA 3. Union Station Homeless Services started in Pasadena and has expanded throughout LA County. I am one of the 8 DV regional coordinators. LA County is separated into sections, and we have 8 DV regional coordinators. And as Elizabeth and Amy were talking about some of the needs that we were needed for survivors, the DV regional coordinator was created to help out with the different victim service providers and the homeless agencies. So we wanted to make sure that in our role, we are the intersection between victim service providers and homeless service providers. So I'm going to talk a little bit about a little bit of history. This role just barely started last year. So we have made baby steps towards creating this role and working with the different providers. My role as a DV regional coordinator, I collaborate with different providers in domestic violence, human trafficking, or somebody that has suffered from a survivor. And I also work with the 3 different systems for housing, which include the youth, the single adult, and family. I work in creating and making sure that we implement policies and procedures by doing presentations in the community for both the victim service providers and homeless services. I work with the different agencies in increasing services. As we discussed, there's very limited services for survivors and accessing housing, and it was very difficult for them to access services. So we have overcome some challenges. We still need to work through those challenges. But since my role came on, we have been able to make sure that the different agencies, we are working together to create linkage between agencies, make sure we create the linkages between the 2 agencies, like when a survivor is experiencing DV and needs housing, that they can have access to the coordinated entry by what would be the fastest way to connect them, knowing that there are 3 systems. So by doing that in SPA 3, we have quarterly meetings in where we have all the DV providers, human trafficking. We also have the 3 systems from the coordinated entry, where we meet every 3 months to discuss some of the gaps that we're missing in our area and that we can improve, and how to make it easier for clients to access the services when coming into our program. So another thing that we have done is, again, we have had gaps where survivors were not being able to be linked to services. So it could be both ways, where the DV provider is referring a client to housing, or sometimes I'll give you an example. We've had a client that was in an apartment and needed to be, because of safety issues, needed to be moved to another location. I'm able to coordinate with the DV providers to see if we could get them into a safe place. So we have several options for a survivor instead of very limited just to DV services. We also have homeless service providers that can be able to assist a client when working with them. So another thing that we also provide, I do go to the different meetings for the different systems and housing to make sure that I am providing updated information on the changes with policies with DV providers. So that way we are all working on the same page when we are referring a client, and the services can be accessed a little bit easier. I also coordinate with the different providers. As I mentioned earlier, we have 8 DV providers. So we do meet monthly, face-to-face, or we also have a phone conference. So we make sure that we are coordinating services, even though in different spas, it might look a little different. we try to make sure that we are all connected and maintaining the same policies and procedures throughout the spa. So that way, again, it's easier if we need to transfer a survivor from one area to another, that the coordination is still the same. And then one of the collaborations that we do between DV providers, again, want to make sure that if a DV survivor or human trafficking is in an emergency shelter and they need housing after they leave the shelter, we have been able to work with the different DV providers where sometimes we understand that the emergency shelter is limited to 30 to 45 days. While we're coordinating to bring them into the homeless services, they might be able to extend them a few more days before we are able to take over to assist the family in coming into the coordinated entry. Because there is, and which is one of the challenges, there is limited shelter in the coordinated entry. Sometimes in spot 3, we do have to use motels to put survivors in. And again, if it's a safe place, we will put them in a motel. We obviously never want to put anybody in danger. But that's the coordination that we have between the DV survivors and homeless services. And the stay in the housing service provider services, which there's 2 programs. One is rapid rehousing and the other one's prevention. So the rapid rehousing, it varies from client. There is no, as you have known, each family is unique or client is unique. So it can vary in how long the services are provided to a survivor. Some survivors might need more time than others. So they might be in crisis for about 90 days before we're able to place them into permanent housing. Or at times we are able to link them to other resources that are available. If a Section 8 is very limited, but if that were open, we would connect them to that. And again, sometimes with survivors as well, it takes a little longer because they're also working on other stuff. Maybe they might be working on legal services. They might be relocating because they can't stay in that area that the abuse happened. So there definitely takes a lot of coordination between the victim service providers and homeless services to make sure that we are bridging those gaps between the services and how we're helping the clients. And one of the other things that I do, just to wrap it up, is we also, I attend the different meetings to work on implementing different type of funding. As we discussed, we have limited options for survivors to go. So we are working on expanding funding to extend services in emergency shelters. We're also working on funding for the rapid rehousing program. So we are able to assist victim service providers, we are able to assist survivors for a rental assistance a little longer than we usually do for someone else that has been experiencing homelessness. Because as mentioned earlier, sometimes they do have additional resources that they need to tap in before they can be able to find employment or get integrated back into the new community that they have moved into. And I will be answering any questions in the Q&A.
Thank you so much, Alicia. Let's see if we can turn to the next slide. Okay, so this is Alyssa again. I want to just briefly mention a resource that some of you may have used it before or may not have, but I highly recommend it. It's actually not the National Alliance for Safe Housing website. That's www.nashta.org. Safe Housing Partnerships is a clearinghouse. We actually worked with the National Resource Center on domestic violence as part of a consortium effort that we are one of the technical assistance providers in, to develop this clearinghouse of information that focuses on this intersection of domestic violence and domestic and sexual violence and homeless and housing. And there is a wealth of resources and information, including actually some of the materials that Amy and Elizabeth mentioned that's part of their coalition effort. So anything from coordinated entry to regulations, you can basically find it here. So it's a fantastic resource. It is a clearinghouse of information that comes in different formats, and highly recommend checking it out if you haven't. And let's see, let's go to next slide, please. All right, so CSAJ, do you all want to pop in and then we'll go to our Q&A after?
Yeah, thanks. Hi, this is Yvette again. Thanks, Larissa. So I just wanted to really give a very quick shout out, because I know there are a lot of questions that folks would like answers to. CSAJ has 3 worksheets. One here is for needs assessment, and there's another for partnership building and systems change. And they really walk you through the process of each of those activities and, excuse me, and trying to figure out, what you already know, the kinds of partners you already have, what you should do to go about filling any gaps, finding out what's currently happening, what partnerships you currently have or should build in order to tackle larger issues. If you want to do a quick slide change to the next 2 slides, just so that they're up. And we'll make sure and send out copies of these worksheets when we send out the email after the webinar. And Sarah, if you have anything to add to them, feel free.
I would just underscore, I know the LA Coalition talked about the role of things like needs assessment and partner mapping and working closely with NASH. So these are a nice kind of first step into thinking about this issue in a big picture kind of way to help you figure out how to kind of approach it more systematically. So these are just a few tools, and I know that Larissa and NASH, they have plenty of similar tools and processes and work. So they're an amazing resource, as are the presenters that we had today.
Yeah. And then we just have a couple of other slides showing resources that are available on CSAJ's website. And I'll just, we can just quickly click through those so that we can go to the Q&A.
I don't think we have a placeholder slide, so we'll just leave it here so you all can think about how you would spotlight your own work on this. And then we can go to the final slide.
Yeah, so I guess turning it back to Larissa to start moderating the Q&A.
Great, thank you. Thank you so much, Yvette and Sarah. And if those of you who are participating haven't seen some of these fantastic handouts and worksheets, you're really in for a treat because they are fabulous and they can really help your programs and really help systems think about partnerships and collaboration in ways that you might not have or you may have and haven't actually applied before. So I'm excited that you'll all have immediate access to it, although it's accessible, but now you know they're out there and you'll get to see it. So thank you so much. So we have a little bit over 15 minutes, almost 20 minutes for Q&A, and I pulled a couple of questions from the chat, and then there were some other questions as well. So I'm going to actually, the most recent question came in while Alicia was presenting, and so I'm going to start there. Alicia, the question that came in for you stated, when you say move domestic violence survivors, how long can they stay at this temporary housing? And I believe it might have been in reference to when you mentioned motels, but obviously you can, speak to it in whichever way makes the most sense. So I'm going to pass it over to you to answer that question. So when you move survivors, how long can they stay in this temporary housing?
So when we move survivors, it can vary on how long, as I mentioned, like it depends where we're moving them from. If they're in an apartment and they need to be moved because of safety concerns, we might put them in a shelter, we might put them in a motel. And that will depend, we would need to find another unit that would be safer, and it might mean in a different area. So that could vary, I want to say that it could take about 3 months to find another unit. But we wouldn't leave the survivor in danger if they have an apartment and there's a situation. We would look for other options, and that option could be that they could stay in the homeless service providers by moving them into a shelter or a motel, or we would collaborate with victim service providers to see if they have any space to keep the client while we continue to look for a safer unit.
Thanks, Alicia. So another question that came in, I'm actually going to go ahead and direct it to Carlo. I think it's a really common question generally that we get as national technical assistance providers that's really specific to who do we connect a survivor with if we think there might have been a violation of VAWA or other housing protections. Who do we connect that survivor with? And that's the broad question. The specific question itself is the survivors at risk of losing their Section 8 voucher. Who would we contact to advocate for the survivor? And I would add in to provide the survivor with additional resources and support because of the VAWA protections, and to help the survivor receive an emergency transfer. So I'm going to pass that one over to Carlo.
Thanks, Larissa. We get that question quite a bit in terms of survivors who are facing terminations, possible terminations, or evictions because of VAWA-related reasons. And so our number one referral is to go to their local legal aid office and to find a legal services attorney that specializes on housing issues, and even further, if possible, if they have some kind of knowledge about the VAWA housing protections. And then usually if there's any kind of custody or divorce issues, there's usually a family attorney that also is involved in their case. But certainly I think that should be one of the first folks that survivors should talk to. If folks need sort of just more general advice that doesn't kind of morph into legal advice, I think that you can reach out to national technical assistance providers like myself and the National Alliance for Safe Housing. And then if you're lucky enough to have local programs like some of the programs we've talked about today, and there are local advocates who could help you, certainly those are resources as well. But there are a number of different ways to approach any kind of situation involving a possible VAWA violation, one being possible legal representation, but there's also a lot of advocacy that you can do with various providers, housing providers, and housing authorities and other folks who are involved in the adverse housing decision. So I think, sort of having different folks who look at the same issue from different perspectives can be very helpful.
Thank you, Carlo. And I'm going to add a quick plug before we get to the next question. Carlo and I authored a community-based advocate toolkit, and it's available both at NHLP and nashta.org on our websites. And actually, I can pull the link up once I ask the next question. It's scenario-based. There are demand letters. That is just a great resource for advocates on the ground. To spot check when there might be something going on that they think is questionable, and also to be able to do some of that advocacy with landlords or housing providers directly. And it's really written, we did our best to make sure it was written in plain language, so it's not in legalese. So I'll go ahead and post that as a resource as well. Okay, so next question. The next question is for Connie and for Alicia. And the question is, the co-location model is seen as a national best practice. What do you believe the benefits are for survivors? What have you seen? And I'll let Connie or Alicia go ahead and start with the response.
Okay, so I'm Alicia. I would say that I believe that the benefit for the survivors is that they are not being jumped around from different providers, where there is an entryway and the providers are having the collaboration, so it makes it less stressful for the survivor. And so the collaboration model works because it is less trauma for the client, and the access to services can be a lot faster.
Thanks, Alicia. Connie, do you want to jump in?
Yes, can you hear me?
Yes.
Oh, great, thank you. So yes, so I feel like the service that we provide here is definitely have been beneficial for the victims and survivors, just knowing that they have that resource and that service, because what I have encountered with individuals that are in the housing is that I had no idea that this service was available, or I had no idea that I had that right. So that has been the main thing, I think, that has been beneficial when working with individuals here within housing.
Thank you, Connie. All right, so we're getting in a couple more questions. We have about 10 minutes. So this question is, sounds like probably from a coalition. Something our member programs have told us is that when they work with their housing authority, the VI SPDAT, and for those of you who are not familiar with that, it's a common assessment that's used in the coordinated entry system to assess placement and prioritization and vulnerability for housing. It doesn't rank survivors high enough. So while they have great referral relationships, it doesn't change things. I'm not sure who would be the best person to answer this. I'm happy to chime in, but I want to defer to the panel. And if anyone wants to give some thoughts on this, I know all communities have been reckoning with this, and actually Los Angeles as well. It might be Elizabeth that comes to mind.
Yeah.
To respond.
Okay,
I'm going to mute myself.
So yeah, we definitely have struggled to try and advocate around this very issue. We have a continuum of care board and different groups that are looking at prioritization in Los Angeles. But the other thing, so this is very common here, that survivors just don't rank high enough on the VI SPDAT to meet the prioritization. And the truth is there's just not enough resources to go around, right? So we have been advocating for a specific carve out with local funding and with state funding to be able to not have to apply those same types of prioritizations when it comes to working with survivors. Though we still have a long way to go with that, because in Los Angeles, even though we have money beyond HUD, this kind of coordinated entry system the model is really being used for all types of homeless services funding. So our advocacy efforts are really to look at, can we have a specific carve out, whether it's local or state funding, for survivors to use either in prevention or in rapid rehousing. We have been implementing the Domestic Violence Housing First program here, which is state funded through Victims of Crime Act federal funding, and we've seen a lot of really good results from that program, and that program isn't touched by coordinated entry. So I think we've struggled back and forth with really wanting to break down the silos, but at the same time, having specific housing options for survivors is really needed. I hope that answered it somewhat.
I think it did. Alicia?
Yes,
is that you?
So
okay.
I'm Alicia, and I also wanted to add on the tool that the DV regional coordinators have looked at it, because a lot of the questions are also might not be answered correctly by survivors. So there is talk of revising the tool, but with everything, it will take time. So that way they're not, as Elizabeth said, sometimes they're not able to access certain services because those questions might not apply to them. So we are working on trying to revise it, but it will take time. unfortunately.
Thanks, Alicia. Thank you. And Amy, did you want to chime in?
Sure. If in our community, if survivors are sort of using the coordinated entry as it's set up, but their vulnerabilities aren't showing up on the assessment tools, we have the ability to use case consultation to advocate on their specific vulnerabilities and help them connect to resources in CES that way, which is one way we've addressed how the VI SPDAT is not accounting for the unique needs of survivors.
Thanks, Amy. And with 6 minutes left, I just want to add one thing from the national perspective. It's important for everyone to know. The VI SPDAT is not an assessment that is, so HUD does not have a specific endorsement for an assessment. This assessment was created many years ago and actually just got a lot of visibility and then attached to it credibility, and was an assessment that started to be used around the country, especially as coordinated entry was becoming a mandate. And so many communities, Los Angeles included, are looking at the assessment with that fine-tuned lens, not just for survivors, but for other populations, and asking the questions that all of you are, which is this working for our community? And if it's not working, what do we do? There are many, many different jurisdictions that are using a different assessment. There are different assessment models. There are models that have questions that are broader and not formed in a way that makes it challenging for those that we also know are in need to not rank where they need to be able to get the support that they need. So I want to say that, and I'm happy to talk more if there are questions about assessments and VI SPDAT, et cetera. So we have about 5 minutes, and I have another question that came in from one of the participants today. And I'm actually going to go ahead and give this one to Connie. Connie, here's the question. Can you talk a little bit about how, and actually, Alicia, you're welcome to chime in too, because it's co-location specific. Can you talk, and this might close us out, can you talk a little bit about how you've addressed safety and confidentiality for survivors in the co-location model? So either Connie or Alicia, whoever would like to chime in first. How have you addressed safety and confidentiality for survivors with this co-location model?
I can definitely jump in and just talk a little bit about how La Casa itself has practiced safety and confidentiality when working with individuals who are expressing or the need for being relocated or working within housing authority. And so what we primarily do is
similar to the
can you guys hear me?
Yeah, it sounds like we have some background noise. Can everyone please mute yourselves if you are not Connie?
Hello? Okay. So,
all right.
So I'm back. So how I've been primarily working with that part with the safety and confidentiality when working with individuals who are in need of their VAWA, it has been primarily making sure that, all ROIs are completed and that we are not communicating with housing authority when it comes to emails or what have you, and making sure that their VAWA declarations and any sort of paperwork is not kept in the same file as their regular housing authority files, and that information is kept separately. And so, and it's more of making sure that housing authority is aware and that we are not speaking in regards to anyone in a public location. It is definitely behind closed doors, and then primarily talking directly with the key decision maker and not speaking with any and everyone in regards to the survivor or victim's case. That has been the primary thing. And when safety, we have really, and making sure that we really ensure the resident, the victim, survivor, that this is the case, because a lot of them have been very fretful of that, saying, oh, well, I have abuser has family members that work within the organization or friends that are on site. So we work extremely hard with making sure that they know that we take their safety and their confidentiality extremely, extremely important, and how much of an extra mile that we go to making sure that that information is kept extremely confidential.
This is Alicia, and I'll just add
Connie.
And I'll just add a little bit.
Alicia.
I'll just add a little bit to it because the same thing. In our end here in Spot 3, it was mainly educating the coordinated entry about confidentiality for survivors. So making sure that they are implementing those procedures by not inputting any information, because we do use DV providers and homeless services use different database. So making sure that the coordinated entry is not entering information, identifying information that would identify the client or their location. So we definitely have been working on that, and that's something that we implemented. I do go do presentations on my own and also with other DV providers to talk about the confidentiality about clients and how it could put them at risk. So it's something that we still need to do a lot more education, but there has been improvement, at least in our SPA.
And I just want to just definitely chime on that one as well. And we do this the same. It's definitely the same as far as the education-wise with the service providers, staff as well.
So it sounds like, on the final words of Connie, educate, training for coordinate entry staff, for your program staff, and for other organizations. A lot of great resources out there. Plugging Safe Housing Partnerships again, but if you have direct questions about how to make this stuff happen, please reach out to us. Thank you so very much for participating. We've enjoyed doing this presentation for you all, and we hope that you have a fantastic rest of your week. Thank you so much.
Thank you.
Thank you.
And this is Sarah. To close this out, I'll just echo thank you to Larissa, Alicia, Amy, Carlo, Elizabeth, Connie, everyone for sharing your innovative work and both the what and importantly the how of partnership. I think that's really important and a lot of good nuggets here. And just a plug, you'll see we included the link to the evaluation form. Please take some time to complete that. It means a lot to us, and we'll make sure to pay forward any remaining or additional questions that you have for our panelists today from that. And it will also help us figure out how we can continue to work in partnership to bring you all the training and the resources and the conversation that can most support and strengthen and deepen your impact. So thank you so much.